Hello, everyone. So, for number one, what skills described in chapter 7 would I use to become an effective manager? I would say organization, so the structure of nursing care, as well as involvement of the whole interdisciplinary team, including doctors, the staff nurses, the involvement of case management, as well as having like physical and occupational therapies, and off service providers that have provided, consultations on the different patients, as well as staffing. I would like, safe staff ratios with patients, making sure that my staff doesn't get overloaded with patient loads, as well as the equal ratio with the new nurses on the floor as well as experienced nurses. Keeping my floor safe and making sure that ultimately the patients are safe as well. Um, I would like to provide like clear expectations for staff, nurses, give them clear, concise directions, be involved in conflict resolution, making sure that everybody is on the same page and that if somebody has a problem, that they're able to come with me and know that I'm able, to listen to them with open ears and give them some direction of how I think things should be approached, and allow them the freedom to try and figure it out, on them by themselves, conflict resolution with the person that they have some conflict with, and that if that does not work, then we bring it to me to where I'm able to facilitate and help out as well. Supervision of the new graduates, making sure that they're evolving like they should as new grads and are transitioning into a nurse staff role good from a student role, as well as involvement of the newest evidence-based practice, make sure that we are incorporating this into our care onto the floor, as well as any kind of things that we have going on the floor for like whether we're doing like Foley's, make sure there's no infections caused by insertion, or whether it's on VAT bundles or any kind of bundles and quality that we have going on, making sure that we're involving new practices. Being an adequate leader, having leadership towards them, as well as motivating nurses, because we all like to be praised for our good as well as being reprimanded for things that we need, to work on, constructive criticism. Coordination as well as involvement of the whole interdisciplinary team as a whole on patients' cases, make sure that we're all on the same page. And for the leadership skills questionnaire, I scored the highest on interpersonal skills. So the ability to know how people will respond to a new idea or the proposal, as well as understanding the organization as a whole. Sensing emotional undercurrents of my staff and trying to meet their needs and goals, as well as motivating through emotional energy. Having respect for others and their opinions, because that really, if we take other opinions into consideration, then we might be able to have, better quality care towards our patients, as well as better communication between staff nurses and the interdisciplinary team. So for number two, how would I use published literature? So the article I found, it provided studies that talked about the role of hospital managers in quality and patient safety. The results varied, but it concluded that management activities comprise strategies such as culture and data sensitive activities, but it also had positive associates with quality improvement measures. Evidence also showed that managers' time spent and work can influence quality and safety clinical outcomes. So the more involved that a manager is with patients as well as with their staff, the better patient outcomes we have as far as safety and their quality improvement. Let's see, number three, levels and departments that I would need to work in to be effective in a management role. So I work currently in trauma and surgical services. So not only would I have to work with the managers on, my service, I would also have to be with different managers in different departments because, like in my instance, we have trauma. We work really closely with like orthopedics. So I would have to have good communication with um, the nurse managers on other floors so that we can coordinate care better, as well as our staff coordinating good as well, and all kinds of different levels of care, whether that be with ICU or whether it be on a general floor, since we're considered intermediate. And number 4, explain if you feel you would have a preference for a vertical or horizontal structure. So I am from a teaching hospital where they have more vertical organization. So it refers to really an establishment of hierarchy. So we have a nurse manager, but we rarely ever see her on the floor unless if there's a problem or, if we have staff meetings or anything like that. Us as staff nurses, we really deal more with the assistant nurse managers on our floor, who, due to our census, we have high census and we have a high nurse turnover rate. So our assistant nurse managers effectively also are charge nurses as well. So we deal more with our assistant nurse manager than we do with our real nurse manager. And I think you have a lack of communication there because if your nurse manager is not on the floor, then they are not there to understand what else is going on. They just go by hearsay and emails that are sent to them. So that's it.